We're here at OrthoVirginia in Richmond talking to Dr. Ken Zaslav, and he is an orthopedic surgeon. We're here to talk about a clinical study that is taking place here at OrthoVirginia. This is for people who have had surgery on their meniscus but are still experiencing some pain but are not they're not a candidate for a total knee replacement. Is that correct?
That's correct. A lot of patients have a meniscectomy. They get rid of the locking or the catching symptoms, but over time they have a little bit of early arthritis and some overload of that side because they're missing some meniscus, and they have pain. Now, I will say that most of our patients who have meniscectomy do quite well, but there's this 30% of patients that often have persistent pain when they try to be very active on the inner side of the knee. And that group we really didn't have anything for before this, except some things to palliate the pain, like injections and bracing and medicine. And they're really not bad enough for a knee replacement, which of course doesn't last forever. So this is a really unique opportunity now to give them a nice bridging procedure that can keep them active and pain-free for, we hope, a decade or so.
And this is called NUsurface. Can you tell us about it?
Yes, the NUsurface implant is a plastic, obviously medical grade plastic implant that looks like the meniscus and is made by a company now out of Memphis, but originally designed in Israel. And this is what it looks like, just like this. And you can see there's a polyurethane center, and then there are these little rings that are made of an ultra-high poly also, which act to give it more integrity and ability to distribute the load from the thigh bone to the shin bone. So if we look at the normal knee model, we can see that the meniscus is a shock absorber that sits between the thigh and the shin. And its job is to help distribute the load between these equally, as well as give some stabilization to the knee. So when it's missing, there's more load, especially if patients who are built a little bit bowed, so they load more on that side. And without the meniscus, they will often have pain. And this implant can go in and replace the meniscus and act like the meniscus. So what we do is we do an arthroscopic surgery where we take out about 90% of the remaining meniscus, leaving just a small rim. And then we make an incision in the front of the knee. We move the kneecap out of the way, and we can just pop this implant right into place in the knee.
Wow.
And there are at least 9 or 10 sizes, and we will size it intraoperatively, looking on the x-ray to find the right size. And once we find the right size, we take those trials out and put the implant in.
So who's eligible for this study?
Patients anywhere from age 35 to 75 who have pain after a meniscectomy and who want to be active. There are a number of qualifying things that we have to do when they come in. So if they call the number that's on the screen, they can call to see if they're potential for the study, and they will be asked some questions. If they pass those questions, then they'll be brought in for an exam. At the time, we'll look at their x-rays. If they're too far gone and need a joint replacement, they're not a candidate. If they have good joint space and then the MRI does not show any major loss of cartilage, the smooth surface, then they can have this implant.
Well, and we're glad you're doing this study. We appreciate it. Thank you for talking to us, Dr. Zaslav.
Thanks for coming today.
All right, you're welcome. And we're going to send it back to Virginia this morning.